of Bangladesh's 64 districts have reported measles transmissions, according to a UN June report. Children under the age of 5 account for more than 80% of infections. And the situation has been driving families into debt.
The financial burden begins with hiring or arranging an ambulance. At first, hospital officials suggested admitting my child to the ICU, but we couldn't do that because there were no beds available. So we had to admit our child to the HDU, where I spent around $1,000.
Financial constraints means many parents are unable to afford the medical attention their children desperately need.
We really struggle to manage the cost of the treatment. If our child had only had pneumonia, we wouldn't have had to spend so much money. I have witnessed the deaths of many children due to measles here. It's unbearable to see a child with a cannula experiencing convulsions and breathing difficulties.
In the past, Bangladesh successfully contained measles, relying on channels set up by UNICEF and other aid groups. But the ongoing outbreak exploded after a political crisis in the country in 2024 introduced reforms to the vaccine acquisition process, coupled with global aid cuts last year, which left thousands of hospitals, schools, and villages here without support.
In the current situation, children are still dying from severe cases of measles. But if we can achieve herd immunity and combat malnutrition, then we will be able to control not just measles, but other infectious diseases too.
Measles is highly contagious, and there's no specific treatment once diagnosed. Prevention and immunization are key. But as it spreads throughout the country, low-income families are struggling to cover medical costs. Logistical and infrastructural challenges are not slowing the outbreak either, leaving many parents on their own. Rahul Radhakrishnan, TRT World.